name is Dr. Augustine. Today we're going to be talking about PEMF, which stands for Pulsed Electromagnetic Fields. And I'm also going to talk about how I use it with my patients. I want to explain it to you because there are some differences. There is low voltage PEMF, which I don't use and I don't recommend. I use high voltage PEMF, and let me tell you why we do that. There are professionals out there such as Tony Robbins. Maybe he's a professional speaker. He was recently speaking on high voltage PEMF, as well as some other athletes that actually use it. Terrell Owens, as well as like Shaquille O'Neal. These guys use it all the time. Phenomenal technology. And let me tell you why I use it. I use it because back in the day, literally 17 years ago, I had a patient named Barbara. She came in, she had a history of breast cancer. She was 78 years old. She had a mastectomy on the right side. At the time, we had our full body scanning technology, and it demonstrates organ system physiology and all of that. Really great stuff. And at that time, I developed the perfect protocol for her. At the time, we were adjusting her spine. We were doing biocranial, again, to free up her nervous system, because the nervous system is truly what heals your body. We then were suggesting very targeted nutrition because her organs were having problems, as well as lifestyle changes, diet, things of that sort. 6 weeks later, no change when we retested Barbara, and no change does not sit well with me. And I was confused, I was bewildered. Why in the world didn't Barbara heal? Why didn't she have any changes? Right about that time, the scan came out with these major updates that would include cellular health. And that was a game changer. We scanned her and we were just eyes open about this new problem called low cellular health, or cellular health problems. You can take all the right nutrition, eat all the best foods, but if it doesn't get into your cells, your body doesn't change. So all that good food and good nutrition is going in one end and out the other. So this was the problem. Also, right about that same time, I was introduced to high voltage pulsed electromagnetic fields. Absolutely amazing. My experience with it was I had a scan done on myself. The scan was done on me, and discovered that I had a shoulder injury. I hadn't thought about the shoulder injury in 15 years, and all of a sudden it went right to that spot, and I was, oh my goodness, I forgot about that. So amazing. I jumped into it head first, and I've never looked back. It's been the most amazing thing actually that I've done, because I don't care what comes into my office, what kind of problem comes into my office, everybody gets better. Everybody heals. Great thing. So what is PEMF? It is an energy field that penetrates all the way through your tissue cells and charges your tissues back up. Back in the day, cellular science discovered that our body's electrical, and you know this because you heard of it. You do an EKG on your heart, you have electrolytes in your blood, you do an EMG for your muscles, EEG for your brain. Our bodies are electrical. And they discovered that our cells actually carried a voltage, an energy in them. The measurable voltage for healthy tissue was 70 millivolts. And every health condition and problem or disease that we can run into, even a broken bone, loses charge in the cells. So painful inflamed tissue like shoulder pain, back pain, wrist pain, the cell charge goes from 70 down to 50. If you have cancer, cancer cells have been measured to be way down to 15 millivolts. So what if we could take these tissues and put them back into a pulsed electromagnetic field of energy and charge them back up to 70? What do you end up with? Normal healthy tissues that work like they should. So this has been a dramatic thing in my practice for patients. And my primary practice, I see chronic illness patients. I see everything from cancer, autoimmune disease, diabetes, chronic illness of any type. We see kidney failure. I have about 5 patients right now that are on dialysis, and we're trying to get them to heal. Now, do I treat cancer, autoimmune disease, kidney failure, diabetes? No, I treat nothing. I cure, treat, and heal nothing. It's always been the job of your body to treat, cure, and heal you. We're just giving it the tools to do the job. And if we can get your cells charged up to where they can actually take in oxygen, nutrition, and fluids and get rid of the toxins, then your body starts to act like it was designed to, which is to heal and be self-maintaining. So phenomenal process. I love this technology. It always works. Why do we use this over just basically taking supplements? Because everybody seems to be taking some sort of supplements out there, and they take them, but they're really unsure if it's helping or not. And this is the problem. I just described it, but this is the problem, just to emphasize this, is that if your cellular health is too low, your cells are not going to take in these nutrients, and therefore nothing's going to change, and you're going to be stuck. We don't want that, and that's why we do what we do, and we get the results, the kind of results that we do, because of PEMF. It's such a foundational technology to get a person to heal. Medicine's not about healing. Medicine's about treating disease. We want to enable their body to heal. Different. So today we're going to use Nathan. Nathan's going to be our model patient, and we're going to actually scan him with the PEMF device to discover areas that are problematic. With PEMF, when you have low charge tissue, it can be sensitive, tender, or even downright painful. So we want to discover that with him. We're going to move the energy all over his body and discover areas that are going to be a problem for him. And then we describe a little bit more on how we use it to get people to heal. So the full body charging, typically we use this for people that are really depleted. Their cellular health is really, really low. And this would be the person that has cancer or autoimmune disease. They're extremely exhausted and fatigued. So we typically will end a session using the full body charge, whereas we'd like to do most of our work with concentrated energy, directing it to various different parts of the body, depending on what's going on with the patient. How's it feel? Pretty good?
Feels good, yeah.
Nice.
Okay, nothing.
Good, no, not yet.
Not yet.
No. The other great thing about this, there's no side effects or risks to doing this. And using this for probably 17 years now, we've had no side effects, no problems whatsoever with patients, because it just charges up cells. A little misunderstanding that can occur if it's not explained well enough is that low charged tissue can be sensitive, tender, or even painful. And so we like to describe to or tell people that we want to find those areas that are low charged because we want to charge them up. So we start, though, the energy off at a nice tolerable level, and we increase it as their body heals and allows for it. Okay? This doesn't heal a person's body. It enables their cells to come back so that their body can heal. Big difference there. So now we're going to actually test and scan Nathan to see the problematic areas, to discover which areas are problematic. So first we're going to start on this side, which is going to be the pancreas. Over here, the liver side, all the way around to the side there. And notice, tell me if you have any areas that are uncomfortable or tender.
Sure. That's a bit uncomfortable, like over here.
So we'd say liver or gallbladder right there. Small intestine, large intestine, both sides. We even go bladder. Also heart, we can check heart. This does not alter the rate or rhythm of your heart, it just charges up cells. Now we're going to have him turn all the way around. And we're going to do his spine, and it's interesting how this proves chiropractic works super well, because when we put the energy back here, he's going to be even more sensitive because neurologic tissue conducts energy really well. So his whole back and shoulders are going to jump a lot. So I always warn people about that, how much they're going to jump. Not even touching him, 2 inches away, and he's jumping. Here's his right trap, his shoulder. So if you have any problems in the shoulder, he'll be able to feel that. This side, other shoulder, traps. Then we like to run it down the spine because you'll feel the energy go all the way around your thoracic cage into your organ systems. Down to the lower back, sacrum.
Yeah, right there. Hurts.
Lower back, that hurts. Sacroiliac on the left, sacroiliac on the right.
Yeah.
Kidney, adrenal, both sides. Come back up. So So that's the scan, and we like to identify those areas, and those are the areas that we then charge up with really concentrated energy. So if you're interested in getting this type of technology done with you, give us a call at 562-860-3404 or email me at draugustine@gmail.com. We do it right here in the office. Or you could find a practitioner out there, but the real critical thing is that you find somebody that has high voltage PEMF. You will feel this in your tissues. You will definitely feel this in your tissues. The thing to avoid or be cautious of is low voltage. Low voltage PEMF, I just had a patient call me about a system that's offered on Amazon for about $915, and it's low voltage. Basically, low voltage today is rated for improving blood flow slightly, but that's about it. It does not charge up your cells so that your body is able to heal. It doesn't enable your body to really heal. So a little caution there. My name is Dr. Augustine from Head to Wellness. I hope this helps. I'd love to hear some questions from you. I'm on social media, TikTok, Facebook, Instagram, as well as YouTube. Have a great day.